will you help a person need an immediate care for an illness or injury? What is the right thing to do? And what are the things should be avoided? Today, we were going to teach you how to apply first aid for basic illness or injury. First aid is the immediate care given to a person who has been injured or suddenly taken ill. It includes self-help and home care if medical assistance is not available or is delayed. It also includes well-selected words of encouragement, evidence of willingness to help, and promotions of evidence by demonstrations of competence. These are now the tutorial videos in applying first aid. Before applying first aid, you must have first a first aid kit box. Now, what have inside the first aid kit box? Let us watch this.
First aid kit box. Alcohol swabs, hand gloves, thermometer, scissors, betadine, hydrogen peroxide, band-aids, squeeze bag, bandage, triangular bandage.
Now, you've done watching the first aid kit box. Then now, let us watch the different tutorial videos. A nosebleed occurs when a small vein along the lining of nose bursts. Most nosebleed look scary but are harmless. Can be treated at home, commonly in children, elderly. Okay, now, let us watch the tutorial video in applying first aid in nosebleeding.
If your nose bleeds, sit down and lean forward. Using your thumb and index finger, squeeze soft part of nose. This part is between end of nose and the bridge of nose. Continue holding till bleeding stops. Do not stop in between. If bleeding continues, hold for another 10 minutes. If the patient is a child, divert attention by TV or stories. Avoid picking, blowing, or rubbing nose for 2 days. Place an ice pack on the bridge of nose.
The next one is breathing difficulty. Breathing difficulty may involve difficult breathing, uncomfortable breathing, or feeling like you are not getting enough air into your lungs. Shortness of breath has many different causes. For example, heart disease can cause breathlessness if your heart is unable to pump enough blood to supply oxygen to your body. Let us now watch the tutorial video in applying first aid to the person suffering from breathing difficulty. Let's watch this.
If someone is having breathing difficulty, immediately call 911 or your local emergency number. Check the person's airway, breathing, and pulse if necessary. Begin CPR. Loosen any tight clothing. Help the person use prescribed medication. Continue to monitor the person's breathing and pulse until medical help arrives.
Call your local emergency number if you notice
chest pain, coughing or large amount of blood, rapid or irregular heartbeat.
Wounds. A wound is a type of injury in which skin is torn, cut, or punctured. Wounds are classified into two: open wounds and closed wounds. Incision wound. Incised wounds are sharp cut like injuries made by knives or broken glass. Let us watch this.
Three distinct techniques are recommended to stop severe bleeding. The first one is direct pressure. Severe bleeding of an open wound can usually be controlled by pressing with the palm of one hand on a compress of cloth over the entire area of the wound. The second one is elevation. Unless there is evidence of a fracture, a severely bleeding open wound of head, neck, arm, or leg should be elevated. That is, raised above the level of a victim's heart. The last one is pressure on the supplying artery.
The last tutorial video is about fracture bone, specifically on the part of the clavicle. How will you help a person has been accidentally injured? What are the first aid that you're going to use or apply? Let us watch this.
Clavicle. Fractures of the clavicle or collarbone usually occur in the weakest portion, which is 1/3 of the distance from the tip of the shoulder to the sternum. First aid consists of applying a sling to elevate the victim's arm and shoulder blade, which fall because of the loss of support from the clavicle, and then binding the arm to the victim's chest. Prepare a triangular piece of cloth approximately 55 inches across the base and from 36 to 40 inches along the sides. Place one end of the bandage on the uninjured side and let the other end hang down in front of the chest parallel to the side of the body. Carry the point behind the elbow of the injured arm. Carry the second end of the bandage up over the shoulder and tie the two ends together at the sides of the neck. Bring the point of the bandage forward and pin it to the front of the sling. If a pin is not available, twist the point of the bandage until it is snug at the elbow. And tie a single knot. The ends of the fingers should extend just beyond the base so that the first aider can observe whether or not circulation is cut off.
I'm Mikey Pangilinan.
And I'm Clinton Miguel, and this is Learn Basic First Aid. Thank you for watching. I hope you learned, guys.
And now, let us watch the tutorial. And now, let us watch the tutorial. And now, watch the tutorial.
Check the person's airway, breathing, and pulse if necessary. Begin CPR. Side, side, side.
Cut.
Ako po si Syril Bengco. Magbibideo po ako kung anong nangyayari dito sa loob ng aming shooting. Let's go! Ito si Pauline, light director namin. Hi! Hello!
Ang hingi ng mga manok, madaling araw na po kasi.
Ito si Clinton, ang aming director.
Madaling araw na po kasi kaya yung mga manok medyo maingay, nagsikilaw na sila, hindi pa kayo makapag-shoot. Maghintay pa po kaya naliligot po sila, mga kilaw na manok.
Ito po ang location namin dito sa Bengco Residence na pamamahay. Ito ang aming mga props. Ito ang aming ano ba to? Projector. Ay, LCD. Ito yung mga camera. Yung mga yung laptop. Ito yung mga pagkatapos namin ito yung mga pasaway. Tignan mo, walang ginawa kundi mag-Facebook.
Si Dianna.
Si Dianna, napaka-insecure.
Yung insecure! Excuse me, mas na muna niya ako nilawak niya sa dito.
Ay, mag-practice lang.
Ito si Chacha. Wala siyang ginawa kundi mag-Facebook, Twitter, Instagram.
Excuse me, number 1 supporter ko.
Magbago at kailan nasan ito ang pangarap ko. Makuha mo ba kayang ako'y hagkan at yakapin? Hanggang sa pagtanong